the system that I'm going to talk about is called frequency-specific microcurrent, and I learned this from Carol McMakin. She's a chiropractor who started teaching about this a couple of decades ago, and she has a book out called The Resonance Effect. And what I liked about this system is that it's non-proprietary, it has a knowledge base, and it's evidence-based. So there's not a lot of research happening in this area, and so not many people doing this. But I and so there's a lot of people that talk about different frequency healings, like all kinds of rife frequency healing. But what's missing is some sort of solid, reliable, even clinical evidence, if not research. And what I found was that in Carol's teachings and the people who follow the system, we get repeatable, consistent results. There's still a need for solid research, but the results are very repeatable and consistent. So that's why I wanted to study with her to see, okay, what frequencies do what and how and why. And she has another book out called Frequency Specific Microcurrent in Pain Management. So some history on frequency specific microcurrent. It was in the early 1900s, thousands of physicians were using this kind of modality, using current for healing. So not just chemical means. Electromedicine was big. And then when antibiotics came along, everybody was so impressed by the efficacy that everybody, the AMA, the American Medical Association, jumped on that bandwagon and decided to stop a whole lot of other therapies, natural therapies, including electromedicine. And they were the license granting body for physicians at that time, and they wouldn't grant physicians a license if they were doing those therapies. So physicians were basically forced for their livelihood to stop doing this kind of work. And so it basically fell out of favor, and done by very few people, like Harry Van Gelder in Canada in 1946 found a list of frequencies, and he started to use them along with homeopathy and other things that he did as an alternative doctor. And then eventually, again, his machine was just lying around when Carol sort of took over his office a long time after, and found the list and decided to play with it and with a machine that she could use. So it was resurrected in 1995. And she found amazing results. So she started to decide to teach about it, even as a way of seeing if other people were getting similar results. So the source of the frequencies is actually uncertain. The mechanism is uncertain. We have some ideas which I'll talk about. And so the machine she started using was the original machines were like plugged into a DC current in the wall when there was no AC current coming out of the wall. That was way back before AC current became the norm. And then she found a transistorized machine that was created by Bob that she could use, and started to use that. So she's been teaching the systems in 1997 and finding reproducible results. It's the kind of this is one of her machines. It's not what I use so much these days, although I have one like this. And it used to come with gloves, which I don't really use, that were carbon fiber gloves, that the current would go right through the glove. So you could put your hand in it and touch someone. And these machines are approved as TENS devices, which are currently approved for pain, but they're not TENS devices. They're quite different. But they are considered very safe, so they have FDA approval as TENS devices. You just can't make medical claims on them. And they seem to work really well for a number of different conditions, including wound healing, pain control, and others. So this is the nature of the current coming through these devices, called a modified square wave. And I won't get into the details of this right now. We'll see if we want to talk about it some more. But basically consists of two channels of current, modified square waves, that are applied to the body simultaneously. So let's talk a little bit about the system and how and why it works. So there's a list from me. She calls the Van Gelder list from his list, and it has different frequencies for resolving different conditions in the body. For example, 40 hertz will reduce inflammation in the body. 9 hertz, so 9 cycles a second, will reduce allergy. 13 hertz will dissolve scarring in the body. 970 hertz will release emotion from the tissue, so buried emotion that's affecting the tissue, creating tension and dysfunction will be released with 970. 18 hertz will reduce bleeding in the tissue. So as what's interesting is that they are very specific. Different frequencies do quite different things. And this is reliable and repeatable in our experience of hundreds of practitioners that are doing this. But the system doesn't just use one frequency, it uses two frequencies simultaneously. So there's another set of frequencies which represents the tissue that's being affected. So 10 hertz is the frequency for the spinal cord, 116 for the immune system, 13 for the lymph, 62 for muscle, and 142 for fascia, and so on. So we have lists of frequencies. And then you combine them to get a very desired specific effect. So for example, if you run 40 and 10 together, what would we expect? Well, it's kind of a simple AND function. If you run 40 and 10 together, you get reduction in inflammation in the spinal cord. Not so much anywhere else. There is some effect, general effect on the body, but if you run these together, it's really focused on the spinal cord. If you run 13 and 142 together, you are dissolving scarring in the fascia. And again, this can be experienced when you run these frequencies. So, for example, if you run 18 and 62 together, you're reducing bleeding in the muscle. And this is one of the frequencies that will be used when there's an acute injury. So you injured yourself, there's some internal or external bleeding, you run 18 and 62 together with electrodes around the area of the injury, and the bleeding will start to go down. So that's sort of the way we think about it in the system. So to show the power of the system, I'm going to talk about the power of combining frequencies in this way for fibromyalgia. As we might know, that fibromyalgia is a serious chronic long-term kind of disease, which one of the signals of it is that you have these different places in the body which are sore, and they're all over the body, and when pressed, the person experiences pain and in general fatigue. And people will often go from practitioner to practitioner and fail to find real relief. So here's frequency-specific microcurrent for treatment of fibromyalgia, where the current is passed through large parts of the body. For example, you can have a towel at the neck and the feet and clip electrodes to these two towels and pass current through the body. Or you can clip 4 electrodes, one on the hand, each on the hands and feet, and pass current from the right hand to the left foot and from the left hand to the right foot in a diagonal across the whole body. So you're making the current travel through all the area of treatment. Feel free to stop me and ask me questions at any time. I'm going to continue talking about fibromyalgia. And so Carol found that she had a lot of success in treating fibromyalgia symptoms. So she started to do a clinical study in her own clinic, and she collected data for 54 fibromyalgia patients. She's also a very good clinician, and what she realized is that what these patients had in common basically was that they all had a history of cervical trauma, which means some injury to the cervical, the neck, spine, due to various reasons, a lot of them due to car accidents or other kinds of concussions and falls. And she suspected that that has something to do with the cure. So these patients on average, had a chronicity of 9.5 years, a variation from anywhere from 1 to 50 years of having this problem. And she also had blood sample data that was collected for 6 patients and analyzed by a scientist at the National Institute of Health. She had one control patient which had similar issues but didn't have cervical trauma. And she wanted to see if this control patient was helped by it or not, because in general, people who didn't have cervical trauma were not helped by her. But most people who have fibromyalgia do have cervical trauma, not everyone. They all had the characteristic pain pattern in the body of the sore points and an average pain of 7.3 out of 10 on a subjective unit of discomfort scale. They were resistant to narcotic medication, didn't seem to help them. And so she decided to try treating them. And what she found was that there was only one frequency combination that reduced the pain. Only one. And that was 40 and 10, which is the two inflammation. 40 is for reducing inflammation in general, 10 is for the spine, reducing inflammation in the spine. And she found this, and which is why she also looked at the cervical trauma, because cervical trauma, which starts here at the back of the neck, then seems to produce chronic inflammation in the spine, which seems to produce these symptoms. And that's what she was realizing. And that's what this is trying to tell us, if how we encode these frequencies is true. All 54 patients experienced pain relief, all of them. The pain was reduced from 7.4 on average to 1.3 in 90 minutes. This is within one 90-minute session. But the pain relief lasted anywhere from 2 hours to 2 weeks. So if you do one session, you're basically out of pain, but it may last only a couple of hours or longer time. And then she kept treating them again, so they came back for more treatments. 58% of them experienced complete resolution of fibromyalgia within 4 months after repeated treatment. Now, she also had them, she said they should have more success if she had them do other interventions, like deal with, if they had problems with gluten, for example. But here's the thing, those are separate issues. Just looking at one session, the people who had their blood analyzed, the 6 patients whose blood was analyzed, the NIH scientists discovered that their inflammation markers dropped steeply in those 90 minutes. So blood was taken before and after the treatment. The interleukin, like interleukin 1, which is an inflammation marker protein, its levels reduced on average from about 400 to 20 over 90 minutes. That's a 20-fold decrease. Okay. That's more than most pharmaceuticals can do. So this has been published in a paper called Cytokine Changes with Microcurrent Treatment of Fibromyalgia associated with cervical spine trauma in 2005. Another interesting thing is that when people get these treatments, they get really, really dopey and relaxed. And this is confirmed by looking at the endorphin levels in the blood. So beta endorphin levels can increase dramatically during the treatment, and an average of a 9-fold increase in 90 minutes. A lot of endorphin increase. And interestingly enough, the control patient did not respond in the same way in the endorphin levels. So we have a 900% increase here. Substance P, which is another marker of inflammation, dramatically reduced in each visit. Again, the control patient who didn't have cervical spine trauma did not respond. And so so that's just that study, with amazing results. And I've treated people who've come to me for depression and anxiety, because I'm primarily a psychotherapist and spiritual teacher. They've come with anxiety and depression, and I talk to them about cervical trauma, and they tell me they have fibromyalgia. And I say, well, let's do a couple of different things. So I work with their mind, but then I help to treat their body, and their fibromyalgia goes away. So I've experienced these things myself. And so here's another thing. What if you run 40 and 116 hertz together? Well, 116 hertz is the frequency of the immune system. And so when you run them together, you turn off inflammation in the immune system.